Our hospital is a fun hospital, and it's a very efficient hospital, very effective one. And it starts with the front. When a client comes into the waiting room, one of the things they'll notice is there's a child's room. That is there for a purpose. We want clients to bring children. We believe that their children are a part of the family and the pet, and when the whole family participates in the health of their pet, that's one of our goals. The thing that I like about our waiting room is it's large, so if people are nervous with their pet and another pet that might be here, they can separate themselves. And I think that's important. I think it's important that it's clean. You know, I've been in hospitals where it smells like a veterinary clinic, and those smells are odors that aren't necessary. And so what I hope clients will notice when they come in to our hospital is that it's very clean in the way it smells.
Off the reception area, we have 4 pretty much identical exam rooms that the client and patient move into. We enter from the back, and that is a hallway and a pharmacy area from which we can return to rooms with medications and vaccines and easily access the things that we usually need. We also in that area have our models so that we can show them knees and teeth, and our pamphlets and pictures that help us explain conditions that are going on.
If you look at our hospital in terms of the part that clients can't see, if they come back into the treatment area, the things that they would see there would probably amaze them. They would see microscopes and blood analyzers and computers, and very efficiently laid out so that we can effectively deal with emergencies, we can deal with all the different problems that we have. Right there in the treatment room, we connect up into the internet that goes into a database for research, so that when we have very difficult cases, we can use the computer right there. Another thing a client might notice, that our surgery room is off to the side where traffic can't go through it, where it can be kept very clean. All the surfaces of the surgery room are clean, good lighting, all the things that we need for the types of surgery we do is in the surgery. Oxygen, suction, electrocautery. Then off the treatment area in another direction is special procedures room, where we do endoscopy, where we use scopes to look in an animal's stomach without surgery, or into their esophagus, or up into their nasal passages. And by the use of this special procedures room, we are developing techniques that before would require surgery, or we wouldn't be able to investigate it at all. And so the special procedures room offers our clients, I think, the state-of-the-art veterinary medicine. Also in there is the dental laboratory with dental x-rays, dental equipment that is top of the line, so that when a dog has dentistry here and a cat has dentistry here, it goes home with the cleanest, best quality dentistry a client could possibly imagine. We have a radiology room with x-ray machines and automatic processors so that we can take good x-rays, take them safely. Also, right in the treatment room, there is an intensive care ward and recovery ward with large glass sliding doors so that I can see animals all the time. If they've come out of surgery and they're not fully awake, they can be seen and watched carefully. Intensive care, you'll see that there's machines to deliver fluids at a certain rate. Many of our pets have IV fluids, and that has to be done where we can hear and see the animals at all times. And so I'm really feel that our intensive care is a very integral and important part of our clinic. Another area that's special about our hospital is that we have an area of isolation, and that's important not only for the people that have a very ill pet that has something contagious, but it's very important for clients that have pets here that they don't want to have exposed to something that's contagious. And so we can isolate a dog and a cat that have contagious diseases in an area of the hospital where the ventilation is separate, and when we go in there we have to wear gowns that we can take off when we come out, and that's all designed to protect the pets that do not have the disease, and also to give the pet that does have a problem excellent care. We separate the dog and the cat wards. It's very important that dogs don't have to look at cats and cats don't have to look at dogs, because we want to decrease stress. The way you decrease stress is you give cats and dogs separate areas and you control noise. The clinic is extremely soundproofed in many ways so that animals have the minimum amount of stress while they stay here. And of course we have the dog runs, and these were designed so that they can be kept very, very clean and well lit, so that when a client leaves their pet here at our hospital, it's safe, it's comfortable, and it's clean.